Welcome to the second symposium, maybe second in a series. We'll see over time. How many people were actually at the first one? Let me see your hands. Raise them high. Great. So there's a good repeat here. And let me ask a question. How many people who, and we'll get into this a bit more, actually actively worked on any of the committees that were involved with the project here? Great. So we have a friendly audience, so to speak, people engaged in the work and committed to it. And as Shell said, I think we're on the path, which is great. When we first started this in May, it was really about how we're going to accomplish this BHAG, so to speak. And I'm really delighted to say that I think we've made tremendous progress. And a lot of what we're doing today and tomorrow is really to review that progress of what was been accomplished over the last 3, 4, 5 months with a really committed, dedicated bunch of folks. And I'm going to talk a little bit more about the actual agenda and the process and the approach actually after this first session. What I want to do is I want to actually dive in to some work so that we get a sense of who's in the room, so you get to know some of the people at the table, you kind of engage in some ideas really quickly as opposed to just watching me, listening to me talk and wishing you had another cup of coffee. So I just want to go through a couple of things here. The main purpose, I think, of the 2 days we have here is to complete and to refine the roadmap, which has really been the goal of the work that the teams have been involved with for the last number of months. And that roadmap is really the direction for the state to move forward on this journey of interoperability, of how we're going to connect systems, how we're going to improve outcomes, how we're going to lower costs, and essentially how we're going to make progress in this very complicated world. And we've got a number of things designed. As I said, we'll talk about that. The roadmap over here, you'll see, is a skeleton at the moment, and we're, over the next couple of days, are going to be working to fill that in. But as I said, I want to get started with the beginning, and we need to start at the beginning with the clients who we're serving. Coming back to that concept of why we're all here in this room, and why do you wake up every day, and why do you struggle to make progress and work in the ways that you do to make progress. And I think we always start with who it is that we're serving there, whether or not it's a student or a patient or a family. The list goes on. And as we think about the client, we think about client-centric and how the work we do is really in the bullseye of interoperability. If you think about information sharing, connecting systems, the reason we're doing that is so we can get better information, so we can make better decisions, and we can improve the outcomes of folks who are doing that kind of work. Now, as all of you probably know, not probably, definitely know, connecting across the silos is a fantastically complicated activity. Easy to say, really easy to type onto a PowerPoint, but from a day-to-day perspective, given the enormous challenges, is a very, very real world. And the tendency in our lives is to focus on those things that we are, most focused on in our jobs. And there's only one person that I know of in HHS who actually has a job that is supposed to cut across horizontal integration. And he's not here, he's on a vacation on his honeymoon somewhere, so we'll update Adam Dondro for those of you who haven't met him. But good sign is that there's at least one in the state, and probably the only one in the country, that actually has a job responsible for thinking across silos, which is sort of uncommon behavior for most people. Now, the way we want to do this, and we've been thinking about this for a long time, how do you actually do that, is by thinking about the people who we're serving. And so one of the ways to think about that is to actually look at some specific cases. And we're not going to get into detail on this. This is just a case, actually borrowed this from Montgomery County, Maryland. This is a case of Mrs. Williams, who's a homeless diabetic woman. She's been in the hospital 3 times the last 12 months. It's virtually impossible for her to take medications, hard for her to have nutritious meals. She has no identified family. And at a high level, the kinds of programs that Mrs. Williams would need to access are a whole variety of things. Homeless programs, housing stabilization, medical programs, nutrition programs, pharmacy programs, all those things. Thinking about how we connect those things, whether or not you're in a small town or a large city or a county, is complicated. I would venture to say every one of you in your organizations has multiple Mrs. Williams that you're trying to create programs for and trying to coordinate services for. And again, that's not an easy thing, and we are not set up to do that. The core of what we're trying to do in this interoperability initiative is to understand who the client is. And on one level, we can look at Mrs. Williams and understand this individual. On another level, we need to understand who are the varieties of personalities, the variety of people that we're trying to service. And what's evolved over time is this concept of personas. So it comes from the human-centered design world and actually the software industry, where we think about the end client, who's going to use our products, and what is it that they need, and how do they actually interact with our products and our services, so that we can design them in a way that they can respond to it, as opposed to the way we're thinking about the way we want them to respond to it. So we've taken this concept and we've begun to apply it in the human services field to begin to think about who are the customers and who are the groups of customers and clients or consumers, depending what word you happen to use, so we can begin to think about how to design our services, not only for the end client, but also for all of us who actually have to provide services to that individual. So whether or not you're a programmer, or you're a manager, or you deal with finance and budget, or you deal with any one of the various specializations and functions, we need to have the ability to see who that individual is. Because when we're designing or developing or creating policy or programs, if we only see that person from one angle, from one viewpoint, all we see is that person from one viewpoint. We don't necessarily see the homeless problem. We don't necessarily see the nutrition program problems, or we don't see the mental health and substance abuse. So we've taken this concept of personas and have begun to develop it as a way for both internal and external providers to really get a view of the client and maintain that person ongoing, day to day. Some organizations do this, actually create Facebook pages for the person, these fictitious people. They create emails for them, and they create these entities that live in their offices. So when they're having meetings, they're thinking about the clients they're actually serving. They create large databases about who they are, where they come from, what other services they connect with, all those kinds of things. So it's kind of a fascinating way of thinking about doing this work over time. And so what we've done is created a number of personas, and we're going to very shortly begin to interact with them. You're going to begin to interact with them to get to know who they are. Now, what we've done is we've created these personas based on subject matter expertise from folks who've worked in the field for a long time, but they don't necessarily absolutely represent California. They don't necessarily represent Los Angeles or San Bernardino. In the event that we were to actually do this work, create these personas with you and work to integrate them into your services, we would look at the data that would be available. And so, for instance, some of the data might look at ethnicity data, for instance. As I said, we'd be looking at lots of different things. So in California, this is just a simple breakdown of the ethnicity within California. Latino population is about 38%, white is 39%, black 6.6%, 15.8%. So we begin to see who it is that's using, who lives in the state, or our community for that matter. And then we look at it compared to the service provision. So again, this is a very simple example. So within the Medi-Cal program, we see that of the users of the Medi-Cal program, 54% are Latino. And as you can see going down that column there. If you move further to the index, you'll see that on a proportionate percentage basis, Latinos are overrepresented in terms of their absolute population. So we'd expect to see more Latinos. Consequently, this would be some data that we'd integrate into our persona development. As I said, it's just one element as we go forward. But we begin to use the data, we begin to create these personas with a really solid sense of who they are, what they want, what they think about, what their needs are, what the services are. And the data begins to give us clues. So what we've done is we've created, as I said, 10 different personas. What we're going to be doing very shortly is beginning to talk about 4 of them. And these are just sketches of 4 people who we've looked at, we've created in our minds, really. And there's Robert Lanton, who's an Iraqi vet. He's homeless, PTSD, depression, and number of conditions. You have the Garcia family, Mrs. Garcia and her daughter, and her daughter's daughter, and the assortment of issues with prenatal care, homelessness, shelter care, those kinds of things. There's Antoine Baker, who's a transitioning foster youth and all the assorted questions and challenges that he has and youth who are transitioning. And then Harriet Cooper, who's a elderly woman who's homebound, medically fragile, and isolated out there. So we've chosen these 4 personas to think about. They represent a broad swath of programs and services across health and human services. And they give us a chance to think about and talk about who it is that we're actually servicing. And as we know, our current system between HHS and Medicaid, early childhood, needs to be able to figure out how to deliver services to these folks, right? Not so easy, especially when you look at the various need sets. So it gets pretty complicated pretty fast when you have more than 1 or 2 people. And so what we're going to do is we're going to start to engage in these individual 4 personas at the table. So what we have here is an exercise that'll take about an hour, and we have about an hour and 10 minutes set up for the hour and 20 minutes set up for this. And at your table are copies of these personas. Every table has a different one. There should be enough copies for everyone. It will actually look like this, and I'm going to tell you in a minute what to do next, but don't grab them yet. So on the left side is an actual narrative that goes into some detail. What I showed you before about Mrs. Williams is really just sketchy detail. This is giving us a lot more detail about this person and what their issues are. What we want you to do is we want you to talk about them. Individually, you're going to read through it first, take a couple minutes, and then with a partner, just choose up one other person. Just have a brief conversation, making sure you understand who the person is, what their issues are. And then as a table, I want you to have a conversation focused in 2 areas. One is, who is this client? Who is this customer? Who's this person? What else do you want to know about this person in order to provide a fully holistic, coordinated care? This is not completely comprehensive. So what else would you want to know about them? What are their strengths? What are their needs? Who are they? What are the issues going on in their lives? And then what are the system issues that are associated with this individual for them to be able to receive the kind of services that we would hope to be able to deliver? What are the things that the system, so to speak, quote unquote, would actually have to be able to deliver? Okay? Now, that'll go on for about 30 minutes, and then we're going to ask you to have a table conversation to identify a couple of things that are really most important about the client and really most important about the system, and if they were able to be achieved, what the world would look like. Okay? A lot of instructions there, but the good news is there's a piece of paper that actually gives you the instructions step by step, and there's actually a facilitator at each of your tables. Facilitators, please raise your hands and identify yourself. When we get down here, they're going to help move this exercise forward. And at the end, we're going to have a little bit of conversation about this. The real purpose here is for you to get to know the people at the table, introduce yourselves first, where you come from, what you're involved with, what you do, and then look at the persona, read it, have a conversation about it, and engage in some conversation. So again, the purpose is really to focus on the clients and the systems that are providing services. So what I'd like to do at this point is just hear a little bit from some of the tables about the conversation. It's delightful to hear the engagement and the interaction that was going on here. So I take it that people got into the conversation a little bit. And it would be great to hear a little bit about what the conversation was, kind of what the what the client needs were, what additional information you needed, and some things on the system side. And then we're going to sort of transition to look for some common themes. And so what I'd like to do is I'd like to ask for a couple volunteers who would be willing to sort of describe a little bit about their person, their persona, who they've been thinking about for a bit, and just describe a little bit of the conversation that you've had. And what are some of the things that came up? What additional kinds of information would you want to know as you were trying to provide services to this person? And then what are the system challenges or the system kinds of solutions that would be really helpful for these individuals? And we won't have time to go through everybody here, but what would be great is if you capture these things on those stickies, the facilitator or somebody will actually at some point give those to Anthony over here, who will magically turn those into pithy statements about some of the observations we've had. So, do we have a volunteer that would like to start us off on this conversation? Right over there. Somebody's being pointed at. There you go. There you go. There you go.
Should we start with the client?
Why don't you just grab a microphone, stand up, sort of introduce yourself, and then tell us a little bit about who it is that you guys were talking about.
All right. Hi, everybody. I'm Renee Bradley. I'm a psychologist and also a scientist. So we have the Garcia family, which has a grandmother who is currently in care of a 2-year-old granddaughter. And there is a daughter in there who is currently pregnant with another soon-to-be granddaughter. And they have lots and lots of problems. It's an understatement. Basically, the daughter is potentially going to be taken out of the custody of the grandmother because the grandmother doesn't necessarily want to be the parent, but the daughter doesn't want to step in and have full custody of the child. Seems like either. So they're at risk of losing the daughter, but the grandmother doesn't want that. So we thought at the client level what information would be really helpful to have would be just more information about the family. So we thought that there seems to actually be perhaps some drug dependency on the side of the daughter who's now pregnant. There was a question about whether or not she had issues with drug use during her initial pregnancy and the implications that would have for the granddaughter. We thought that there might be perhaps co-occurring mental health disorders as well, and that information would be useful. So our next sort of theme was we thought we'd like to know a lot more about services that they are presently receiving versus the services that they were eligible for, because we had minimal information about that. And we questioned whether or not the family themselves actually knew much about what they were eligible for. And the final theme we had was communications. So given that this family, the grandmother is primarily a Spanish-speaking individual, she is not very literate, and they only have a landline. So we questioned how best to be able to get information to them, get information from them, and sort of keep the ebb and flow of communication going between service providers and the family.
Were there any specific system-related things that you would think would be particularly important?
Kevin Gaines, State of California, Social Services. System-related things. Number one is we figured a culture change would be in order. Everyone moving toward a common goal and defining success the same way. So, the drug and alcohol system would see a family success the same way as possibly the folks who are monitoring the foster care case. Second is coordination across delivery systems, and among all of the different public and private and nonprofit individuals who are interacting with the family. And communications across physical boundaries. County boundaries are relatively artificial. I mean, among the client base that many of us serve, there's lots of transiency of folks who are involved in these receiving services. And so if there were a way to link across county boundaries, across departmental boundaries, that would probably be useful.
Any other comments from the table? Want to add on to that? So I think you hit on one thing that was interesting, which was the concept of who else needs to see the client from within the service delivery group. And that theme is something that is, I think, really important to the whole couple of days we're spending here and the whole roadmap, which is, yeah, we want to deliver services, but who else needs to see that person from their viewpoint? That's what I was trying to get across before. And by engaging that perspective and by trying to focus on that, we begin to uncover some other things that might be common across that client group. So that when we're looking at them from a medical perspective or a pharmaceutical perspective or mental health perspective, we're communicating those things. And it's not just an isolated service delivery there. There were a couple of other tables that had the Garcia family, I think. Who else had Garcia family? Just quickly, was there anything that you would add to that conversation in terms of your observations? Kim?
We observed some of the same things, but something else that came out of our discussion that I thought was really interesting was the systems working together need to take into account geography and motivation. And the motivation piece I thought was really interesting because with this particular family, we weren't clear on Marisol's motivation to keep her kids or the grandmother's motivation not to want to fully adopt the 2-year-old. So understanding the motivations for the parties involved could help with the development of the plan for that family unit. And the pathways. And then I think the other thing we talked about was agile and situation-based confidentiality and information sharing, because there is not going to be a single end point that this family is going to reach and then everyone's done. And so it's going to be a lot of, it's about bringing some of the activities into a tighter range of ups and downs, but there will always be different pathways. And so rather than just being reactional, really thinking about, okay, so if Marisol does relapse, then we need to be prepared for A, B, and C. So.
Sounds like a lot of coordination and theming and communication is important there. Thank you for that. Let's hear another person. Another persona. Who else would like to talk? Different than the Garcia family? Who would like over here? Okay, Gretchen. And again, just tell us who you are and a little bit about the persona that you were working on.
My name is Dan Southard from the Department of Managed Healthcare. Dan Southard with the Department of Managed Healthcare, and our scenario was Antoine Baker. Antoine Baker is a 20-year-old gentleman who emancipated himself at 18 years of age from the foster care system after being in 11 homes. From his description, he's kind of a wanderer, wants to do better, get a GED, go to junior college, but doesn't know how to do it, has inability to get transportation, has been in and out of the emergency room on a few occasions, has no documentation from his foster care, his health records, or any of those things. And so what we would need to see from this client, based on our conversation, was his history, his caseworker's previous and current, if we had that history, his medical conditions, treatments, mental health related issues, all past medical history, where he is now and how do we contact him, because he seems to be a wanderer staying on friends' couches and in and out of different areas. As a participant in the foster youth program, what gaps does he see that we could fix? Finding out from him this broken system, because our discussion led to, it seems like the foster care system failed him and he wasn't set up to succeed leaving the foster care system. So asking him, how could we fix that system so we can be more proactive? In regards to systems, central record of all medical education and foster family history, so we could obtain that at one place instead of having to go to multiple agencies. Central system to identify resources for individuals such as this. The only place he has been that we can identify was the emergency room, having ability for him to obtain information on the services he could receive while at that facility and being recognized by the staff and promoting him to see that type of liaison would be helpful. and a foster youth system growth and transition plan, using a mentor or a life coach throughout his foster system care to give him the best chance of being successful when he leaves.
Thank you. And anyone else who worked with Antoine's persona would have a comment they'd want to add to that? This point? Here.
One of the things that we thought was necessary was for him to have a unique identifier of some kind, because one of the problems with Antoine is that he doesn't know where his birth certificate is. He doesn't necessarily have a social security card. We have no way of knowing how to find his records, because we don't even know if he spelled his name the same way in all instances. So that's important. Another one was our no wrong door policy for whatever the portal is or the system that he goes into. So no matter what direction he comes in through the system, whether it's through emergency medical care or through the court system, he always ends up in the same place through the ombudsman or whatever it was you were talking about that helps coach him in the right direction. It always leads to that person, so he has no trouble finding that. And finally, we perceive that there are so many legal barriers to getting these systems together and talking to one another that we really need legislative changes and a modernization of state legislation in order to facilitate this kind of system.
Great. Thank you very much. All of those topics could take a couple of days of conversation, I'm sure. We're beginning to see some themes evolving here. Let's shift our focus to this side of the room here and look for some volunteers. We have a couple of different personas on this side. Who would like to speak a little bit about the two folks that we haven't heard from yet? Any volunteers? Oh, I think there's a volunteer being volunteered. Oh, there's one. Got it. Okay, there you go.
Good morning. I'm Sarah Deanna. I'm from the Office of Systems Integration. I guess I'm the volunteer, according to Richard here. Thank you very much. Yeah, he's a really good facilitator. He's forcing me into this. Anyway, we had Robert Lanton, and he was a veteran who's come out from the war, and he appears to be experiencing PTSD, which is creating all kinds of problems for him. He is now homeless. He's had his DUI, so he's lost his driver's license. He has a family. He has a fiancée with a child, but he's now estranged from them after having some outbursts with them due to his, we consider, anger management problems. So he's really is in need of a lot of help at this moment. So the brief description that we had, we felt like we needed a lot more information about him, about his background. We wanted to understand more about his military experience. We'd like to get information from the DOD. We'd like to understand better what kind of support he has, either family support or other organizations, through the VA, through friends, whatever. We wanted to understand more of his employment history. So obviously he's unemployed at this moment, so what was his employment history so we can help steer him. We wanted to understand what access he has to services already. Where has he reached out already? We didn't know that. We wanted to know what he wants. That was probably the most important things. What are his goals? What does he want from his situation? What's most important to him? Wanted to know more about his criminal background. So we know that he got one DUI. Was that his first one? Second one? We don't know. Does he have other criminal activities that are popping up that's going to create more problems for him? We also wanted to know if he had any other history. For example, was he a foster child? Did he go into the military service after foster care? Is there other things contributing to his situation? And finally, we wanted to know about what kind of benefits he's already signed up with, so what he's got. And then that was just him. Now he's got his fiancée and a child. So we wanted to know a lot more about them as well. So we wanted to know what kind of ability does his fiancée have to care for that child, financially, health benefits, all of the same kind of things. What's going on in that situation? So just a lot more information we needed from those kids. And I think you were going to talk about this situation.
I'll just talk a little bit. My name is Derek Hawley from Placer County Systems of Care, and like the gentleman said over there about the no wrong door, I mean, that's so true. Actually, last week I was in a situation where almost this exact same scenario happened, but the identified client was the child, and it was in a wraparound was a wraparound case. And they came to me saying, wow, we have this gentleman who presents to us, he just came back from Iraq. The woman, the wife was very frightened that he wanted to harm himself. So my very first question was right away, do we think that this person has thoughts of hurting himself or commit suicide, and we might want to, act on that right away? That was my number one concern. If that was, not an issue, is like, well, how can we now? I work in the children's system of care. How can we get him he's in our door now. How can I facilitate him getting into our other services that might be available? So I called our intake manager saying, wow, what can we do? I explained this, the situation to him, and can we get him in and get some eyes on him? And the question came up, well, does he have health care coverage? Well, yes, he does. So he's like, well, we can't bring him in. So we really need, one of the issues is how can the county work with our local, managed care plans or local health plans into facilitating these kinds of clients, because they do come in our door. We don't want to just say, go away. You need to go and call this other person. How can we really help connect him without, causing more barriers for him?
Thank you very much. It's interesting when reality confirms things, right? Anyone else with Robert that would add a comment to that? Something different? Additional? All right, so I think we have one more persona. I'm looking sort of in that end of the table there. Oh, sorry, I wasn't looking into you there. Bring it back.
My name's Erica Pixton. I'm from California Department of Social Services. I think the only thing that we thought of that we needed from Robert was his cultural context. What's his cultural background? What's his family background? Because that may play into the kind of services he is or is not willing to accept. Did we talk about system needs? No, okay. Our system needs, we kind of came up with the catchphrase of no hoarding, make the information discoverable. And really trying to get the systems to share. We talked a lot about policies, legislative policies, department policies that support receiving and releasing information, and also getting the operational issues, funding streams, practices, issues that support both receiving and releasing information. And then the last thing we talked about was a buy-in and a cultural shift within all of the agencies to shift from a culture of hoarding to a culture of sharing information.
Lots of overlaps there as well. So one last volunteer. Has our facilitator identified a volunteer to make? Oh, great. Right over here.
My name is Daniel Bach. I'm with Monterey County, and we were talking about Harriet Cooper. Harriet's in her late 70s, recently lost her husband, has numerous medical issues, coronary issues, medication issues, blood pressure, disprescribed oxygen, also having some issues with frequent hospitalizations, some decrease in cognitive ability, and we were talking about the services that were necessary. Some of the points we talked about that were specifically missing in context of Harriet's story was a lot of her social history. Connections, she has sons, but limited contact, been in the community 30 years, but didn't really talk about the connections she has in the communities, why they've dissipated, what information is there. It talked a lot about where she currently is, but it really didn't talk about what she was missing, services necessary in the context of provision of social services. She has a lot of connections with different providers, but we didn't have all the specific health information, all the specific nutrition information in her recovery. So we were basically wondering what other services is she receiving, what could she be receiving, what could she be eligible for. And in that process of discussing that, we were basically talking about the need to have more integrated information, having an integrated team that understood everything that was going on. So if her doctor was concerned, making sure her case manager knew, and if her case manager knew that she had access to the information that would let her sign up for better nutrition services, how would she cross Social Security, Medicaid, in-home supportive services, potentially hospice care in the future, potentially going through the needs of all of her protected health information so that we could predict rather than always be responsive. There was a conversation that the system was being reactive to her needs as it happened, but no one was getting in front of the curve of being preventative for her. We talked about it somehow looking at having a more client-centric view of all the services provided. So having some technology or information ability to say, here's all the different points, how can we access them to be informed, to be in front of her, to help her see what she could be eligible for. We talked about the fact the system should be more client, well, I can't read that one. That one, that's it. Having more of a true care model for her, something that was wrapping her so that, actually I think we even said that, having a wraparound for her so that everyone knew what was there and working as a team to make sure she got to what she needed. So we were talking about how can we get that done. We also talked about a component of education, that when she's touching these different systems, the people in the system have to be educated to know how they work within that context. How can they navigate? What can they have access to? How can they share that process? And not always being wondering what is the available services, how do I get to it? So as we were walking through that, we also talked about how can we want to sell that and process. And I think a tagline that came up was like for a headline was like having this high technology with a stamp that said "Grandma approved," something that so it's like in structure. So as we were walking through, we were just trying to create that holistic approach of wrapping her with the services, because her whole issue with Harriet was she wanted to be home more. So the issue is, how do we keep her comfortable? How does she have control in her life, feel validated, be responsive to the system so that she could live the way she wanted to, but have enough social history that you can put some context in her community for her and keep her there? Were there other?
Thank you very much for that. I want to just point out some of the common themes. I think you probably even heard them, but the ability to see across systems, to be able to see across departments and agencies, to be able to gather all the information that you don't have, that is so important to being able to really provide the services to keep someone in the home, or to keep them from an institution, or going back to, back into a hospital, which is incredibly expensive, or to be able to provide the wraparound kinds of services. And that's really, in many ways, really at the core of this interoperability work, right? It's about how do we have a view, depending on whatever door we walk into, we can see that client and provide those services. So I think I'm hoping that you get a sense of hearing from very different worlds, whether or not it's the VA world or older Americans, those kinds of things, that there's so many common themes that if we open our eyes a little bit, open our purview a bit, we can see that there's a lot of commonality here.